The Gordon Center has been around since the late 1970s. We've been really the leaders in stroke education for quite a long time. And today, we're focused on doing our stroke education workshop, really focused on detection and management of patients with stroke in the out-of-hospital setting. We have a combination of didactics using interactive methods such as the audience response systems and videos, in addition to also doing hands-on evaluations with feedback, how to do appropriate stroke exams or stroke screening exams or stroke severity scales.
In real life, patients never present in a textbook fashion. So initially it might seem textbook, and as you look deeper, you will see the curveballs that were there, which is very applicable to real life.
The assessment that they kind of harped on is getting to the patient and identifying your stroke as fast as possible. So they do something called a BFAST exam, kind of basic movements and motions like that to gauge the patient and be able to identify that they're having a stroke.
Being quick and thorough in that initial contact with the patient, that allows the patient the best chance for survival.
So it's so important that both the public, EMS, and others in healthcare be thinking about stroke and be able to detect the signs and symptoms of stroke so that we can get the patients to the right care and really make a huge impact on people's lives.
Medicine is something that's always evolving, so there's always new studies or new ways to approach patients, and when it comes to stroke patients, it's kind of sensitive. So being taking this class was a good refresher for me to kind of get my skills, more sharpened.
It's awesome to see the hunger and thirst for knowledge in this area that we encountered with all of the participants. They leave the workshop feeling so much more confident. It makes me just feel so good that they're going to go on and take care of their patients or bring it back to their departments and be able to have these conversations at this deeper level that's going to really lead to improved patient care and patient outcomes.